So here we are. This is the second piece of the axial skeleton lecture. We already talked about the cranial bones, and we talked about how those holes are for cranial nerves to pass through and blood vessels to pass through. We talked about structures for muscle attachments, and we talked about ones that are related to the sense organs. Okay, so now we're going to be moving on to the facial bones. So the cranial bones, their job is to enclose and protect the brain. What's the function of the facial bones? They provide the shape, the structure, and the muscle attachments for our facial muscles. Okay, so there's a lot of important structures here. The shape and structure of your face comes from the bones underneath them, and the thing that allows us to move our mouths and talk and make all those facial expressions, those are all related to the facial bones. Okay, so when we look at the eye, let's start with the eye right here. Okay, for the eye, there are quite a lot of bones associated with that. Okay, so let's go through them. Okay, so let's start with the bottom edge. So this right here, this bone, what bone is this? This is the maxilla. So the maxilla is the one, their top jaw. This is the mandible. So this right here is the maxilla. And the maxilla is going to have a process that comes up and makes up the kind of medial inferior portion of the orbit. Okay, so this little lip right here, that's going to be made up from the maxilla. Then we have let's kind of work our way through. Then we have the frontal bone. The frontal bone will make up your top, where your eyebrows would be, right there. The frontal bone right there. Where's zygomatic bone? The zygomatic bone makes up what we consider your cheekbones. Okay, so the zygomatic bone is this one right here. And so here would be the zygomatic bone, and it's got this process that sticks up, and it's going to make up the bottom portion, the inferior portion of the lateral part of the orbit right there. Okay, that is the zygomatic bone. Then we have the ethmoid bone. So we talked about that one a little bit for the cranial thing, in the cranial lecture. So where is that found? Remember, that's deep behind the nose. Okay, so not superficial, that's the nasal bone, but deep back in there, that's where you're going to find the ethmoid bone. Okay, so nasal bone here, ethmoid bone deep inside of there. Now, when we look into the eye, we're going to see this little canal-like structure here. That is where your tears drain. Surrounding that is going to be called the lacrimal bone. Okay, so the easiest thing to do for that one here is surrounding that, look for that canal, that's where the tears drain. That's going to be the lacrimal bone. Okay, so the lacrimal bone surrounds that lacrimal canal right there. So behind that, posterior to that, is going to be the ethmoid bone. Ethmoid bone, deep in there. Okay, now, so notice that the ethmoid bone is on the medial side. What's going to be just lateral to that? Okay, so on the other side over there, that is going to be the sphenoid bone. The sphenoid bone. So ethmoid bone will be medial side, and then the lateral side is going to be the sphenoid bone. Now, the last little piece is the palatine bone. And the palatine bone is not even really, you can't even really see it in this picture. And I'm going to have a really hard time showing it to you also. But it's going to be the one kind of really far back deep in there. And it only contributes a small little portion to it. Okay? So I think it's important to kind of look and see what creates the orbit for no other reason then it's a really good opportunity to review a lot of the facial bones of the skull. Okay, so there is a mnemonic device to remember all of the ones that go in there, and it's many friendly zebras enjoy lazy summer picnics. So what would M stand for? M stands for maxilla. maxilla, maxilla. F stands for frontal, frontal. Z stands for zygomatic, that's your cheekbone, zygomatic. E stands for ethmoid. Remember, ethmoid on the medial side, and what was on the lateral side? Sphenoid. Okay, so E stands for ethmoid. L stands for lacrimal. Remember, look for that little canal, the lacrimal canal. L stands for lacrimal. And S stands for sphenoid on the lateral side, sphenoid. And P stands for palatine, palatine. Okay? Many friendly zebras enjoy lazy summer picnics. And if you think it's easy to find a picture of a zebra enjoying a picnic, it's not easy. Okay, which of those facial bones had teeth? There's two, and the good news is they both start with M. Okay, so the two ones that have the teeth, we have the maxilla on the top, and then the bottom one here would be the mandible. Okay, so there's two paired maxilla, and there's one mandible. Okay, what was the name of the border right along where the teeth would go? So basically where your gum lines would be. Those are called the alveolar margin. Alveolar margin, right along here where the teeth connect to the skull. Okay, let's look at the nasal cavity. So in the nasal cavity, notice that it's divided by a structure right down the middle of it. That's called the nasal septum. And the nasal septum is created by three parts. Two of them are bones, and then the front part, so the anterior portion of the nasal septum, that is going to be made up of hyaline cartilage. That's called the septal cartilage. Okay, so you notice that when you look at a skull, they don't ever show you the front part of the nose, and that's because it's made up of cartilage and not bone. Okay, so that's gone on my skull here. But the back part, the posterior part of the nasal septum, that's going to be made up of two different bones. The top part of that, okay, so remember what's deep in here that makes up the roof of your nasal cavity. Do you remember? That's going to be the ethmoid bone. Yeah, okay, so deep in there, the ethmoid bone, you can see the ethmoid bone in three places now. You can see the ethmoid bone right here, where you can see the crista galli that's surrounded by the frontal bone. You can see the ethmoid bone on the medial side of the orbit, the eye socket. And now we can see the ethmoid bone making up the superior portion of the nasal septum right here. Okay, so that's called the perpendicular plate. So here is the ethmoid bone. The top part of the nasal septum, that's going to be made up by the perpendicular plate of the ethmoid bone. Now the bottom part, that's going to be made up of a different bone. So this bottom part right down here, this is called the vomer, Okay, so we've got the ethmoid bone having the perpendicular plate coming down, and then the vomer on the bottom. Okay, that's all together, that makes up the nasal septum. Now let's notice the walls of the nasal cavity. Okay, on the walls of these nasal cavity, we've got these structures that kind of come in like this. To me, they look a little bit like crashing waves or maybe like shells. Those are called the nasal concha. So the nasal conchae, which is the plural form of that, the nasal conchae, there's three of them on both sides. Okay, three paired ones. You have the superior nasal concha. That is going to be part of the ethmoid bone, and that is going to be so far kind of into that cavity that you will not see it. It's really hard to see. You would not see it unless you had a section through the brain. Okay, so most pictures or most models, you're not going to see the superior nasal bone, but superior nasal concha, but what bone would it be on? Okay, anything related to the roof of the nose, the roof of the nasal cavity, is going to be the ethmoid bone. Okay, now what you can see is the middle. Okay, so this middle one right here, that is called the middle nasal concha. Okay, middle nasal concha, and that is also part of the ethmoid bone. So the superior and the middle nasal concha, both of them are going to be part of the ethmoid bone. Now here, down here in pink, is called the inferior nasal concha. Now the inferior nasal concha is a separate bone. It's its own entire bone. It's just a tiny, tiny bone that has that crashing structure, and that is the inferior nasal concha. Okay, so we'll talk about more of the function of the nasal concha when we get to the respiratory system, but basically what it does is it causes the air to turbinate, which just means to mix, to kind of move around, and that's going to help moisturize the air, which makes it easier to breathe. Okay, so 3 nasal conchas, superior and middle nasal concha on the ethmoid bone, and the inferior nasal concha, its own separate bone underneath it. Okay. So when you look inside, so if I were to have a sagittal section of my bone, which I do not, unfortunately, then you can start to see the cavities in there. So when you look at the nasal cavities, when you have a full living tissue, that's going to be lined with a mucous membrane. And it's called a mucous membrane. So the mucous membrane is going to secrete mucus, and the mucus is going to help keep it wet. Okay, and that's going to help moisturize the air. So get water into the air, which makes it easier to breathe once you get down inside. Okay, it also will help trap the debris. Okay, so we can see you have the superior nasal concha, the middle nasal concha, and the inferior nasal concha. We also have some sinuses, and these sinuses are called paranasal sinuses. Para means next to, okay? And these paranasal sinuses are going to be continuous with the nasal cavity, and they're going to be found in basically all of the bones kind of nearby the nasal cavity, okay? So let's start with the top one. So above here, you can actually kind of feel it on yourselves. Right about here, this right here, you have a hollow cavity inside that. That would be called the frontal sinus. So the frontal sinus would be in the frontal bone. And then behind the perpendicular plate of the ethmoid bone, you also have the ethmoid sinuses. Those are sometimes called the air cavities. Okay, so there is the ethmoid sinus. Okay, the air cells right there. So frontal sinus, ethmoid sinuses, or air cells there. And then in the sphenoid bone, you'll have another one. So here's the sphenoid bone right here. And then also right here, okay? Sometimes, especially if you're kind of cold, you can really feel these ones especially a lot. Okay, so these ones right here, those are going to be called the maxillary sinuses. And the maxillary sinus, again, like you notice, like you guessed, those are in the maxilla. So frontal sinuses right about here. You can feel them in yourself. You kind of tap on them. You have the ethmoid air cells or the ethmoid sinuses kind of deep in there. Sphenoid sinuses would be very deep at the back, like the back part of the nasal cavity there. And then the maxillary sinuses right here. And again, these are all continuous with each other. And that's why if you take, neti pot and you dump water in it, it can clean out all the sinuses and it'll just come right out through your other nostril. Okay, so let's look at what they look at if you take an MRI, you can see the nasal cavity. So here's your nasal cavity there, and you can see the maxillary sinus right there next to it. Now what we're looking at in this picture here, we're going to look at some pathology. For pathology, remember, means there's some sort of disorder. What we're looking at here is called sinusitis. Sinusitis. Anytime you have itis at the end of a word, that just means inflammation of whatever's before it. Okay, so sinusitis just means inflammation of the sinuses. So those mucous membranes are all inflamed and swollen, okay, either by an infection or allergies. And so because they're all inflamed and swollen, that's going to interfere with, breathing and drainage. And so a lot of the problems when you have a cold or you have sinuses, a lot of that symptoms comes from the swelling of those mucous membranes. Okay, and in this picture here, what I'm showing you is a deviated septum. So remember the septum, that's supposed to go right down the middle of the nasal cavity. Okay, so there's your nasal septum right there down the middle. And so deviated just means, off to the side. So the deviated septum means that it just means that the septum, the divider, is not running straight up and down. Okay, and this can be fixed with surgeries. And right here, we just have a tumor in the nasal cavity there. Okay, that's enough for now.